And we are joined on the programme by Dr. Ciara Steele and also Sinead O'Brien, both Clean Air Advocacy Ireland representatives. A very good morning to both of you. Thank you so much for
Good
your
morning,
time.
Greg.
Morning, Greg. Hi.
Good to have you with us. Okay, right now, Dr. Steele, I'll start with you. We have
Yep.
data, don't we, that shows the impact non-clean air is having on particularly our young people, and we've touched on this in, I think it was in a different couple of contexts in the past. So it's good to get sort of a straight up convo on this
Yeah.
specifically. So what's your observations, or what are the observations, and what's your concerns?
So the reason we want to focus on clean air in education is, first of all, the physiological makeup of children. Their lungs are smaller, their respiratory rates are higher, they are more exposed to indoor air quality and pollutants than adults are, for example. They're more vulnerable. But what we wanted to focus on sort of was the focus on the Minister for Health on uh, absenteeism from schools in the education sector. So what we want to call on the minister to do is to actually focus, as well as the unexplained absence, to actually focus on the illness absence that has hugely increased over the last 4 to 5 years, but that we can actually do something about that, because there's emerging evidence now from a lot of studies. In Bradford, the Class Act study, and California studies would show that increasing ventilation by 4 litres per second per person actually reduces illness absence by each increment of 3.4%. So we're not actually utilising the tools of ventilation and filtration adequately within our education system to address the 128% increase in explained illness absence over that period of time. Like, it's a massive increase, and that also needs focus, is what we're
Well,
saying.
that's what I was going to ask. I mean, unless the schools are more crowded, is it new schools that are contributing to it, or what might drive such a dramatic increase?
Well, I suppose it coincides with the start of the pandemic, but the pandemic has increased a focus on indoor air quality in schools in general terms. There's other respiratory viruses that are focusing on at the moment. Measles is airborne, for example. RSV, notifications to the HPSC of strep A, pertussis, RSV, influenza have all increased over that time frame as well. But we do know that children spend about 90% of their time indoors. So their indoor air exposure to pollutants indoors is really, really high. But also over that time, the focus on PM 2.5 and other pollutants like VOCs, xylene, for example, pollutants from paint, they're all emerging as really important air pollutants that affect children in school. For example, Ireland has one of the highest instances of childhood asthma in Europe and in the world. And we know that increased incidence of infective respiratory disease can not only trigger asthma, but also cause it. So these are all compounding impacts of indoor air quality on children in our education system that need focus.
Sinead, we have the solutions, don't we? I mean, we're not starting from square one here. We know what would work.
Yes, and I think just to go back to the report that was published by TUSLA, I'd just like to highlight that that's 2022 to 23 data, showing a 60% absence rate among students in primary and secondary school, which is very high. I just like to highlight that the government's response to that is to sort of focus on attendance and kind of pressurize parents to sending their children into
Well, I
school
was going
when
to get
they,
to that actually, because there is a presumption that this is about refusers or no showers or bad parenting.
yeah, and I think that we really need to focus on the 60% that we know that 60% of children aren't attending school due to illness. Like that is the known. I suppose the other 40% is less known, but may very well be related to that
Mm.
60% who are, absent due to illness.
And
And
most
so,
parents listening too, it's not a choice you make for the crack.
no,
Because in
absolutely
many
not.
cases it could interrupt your work. You might not have child care options. You happen to call on a relation. you don't willfully keep kids back from school. There's generally,
Exactly.
no, I mean, there's obviously exceptions, but there's nearly always a reason, and it's complicated to plan for it.
Yeah, and I don't think I would just like to emphasize again, I don't think parents should be penalized for doing the right thing and keeping their children home when they're ill for their own children's sake, but also so as not to spread pathogens in the classroom, making other children sick. And so that's just sorry something that I'd like to just point out. But just to answer your question
The
again,
question
just
was
I don't know
really
if I
about we have the solutions to this, or at least we have the stuff that would improve the air quality in schools.
Yeah, so I suppose Ciara already alluded to it, ventilation, like just simply opening windows would make a huge difference. But also introducing the HEPA filters, which I know many classrooms had introduced in the early days of the pandemic. But I think there's been a general reluctance to implement them because there's a fear of costs, energy costs, but which are actually unfounded because a lot of the technology is quite energy efficient. I know that there is the HSA, the Health and Safety Authority, have a guidance and a code of practice that actually requires employers to have clean indoor air quality for their employees, of which teachers are. Now, it's I find it very sad that we're not actually looking out for the welfare of children in classrooms, because obviously we can see that being in often overcrowded classrooms with no ventilation is having this negative impact on their health when we have 60% absentee rates due to illness. So having just simply those tools employed would make a big difference. But I do also think that kind of the behavior change that would keep people home or allow people to stay home from school when they're ill would also make a big difference in not spreading infections throughout the classroom. And I think that's something that parents should be commended for and not penalized for, because as you say, they're not keeping their children home for the crack. It's very oftentimes inconvenient, but it is beneficial to the child and to the rest of their classmates.
Yeah, Dr.
Evidence
Steele
shows
too.
that.
Yeah, go ahead. Yep.
Sorry, evidence shows that there's a ninefold return on the cost of introducing HEPA filters into schools and increasing ventilation and filtration in tandem to quality air standards. So there's a ninefold return on that investment, studies have shown. Also, there's other tools that can be used to make air quality in classrooms visible that have been deployed in other countries, for example, like Latvia. Like that there's a dashboard in Latvia from all the schools in Latvia, and it shows CO2 levels, humidity and temperature levels in every classroom in Latvia. And making that visible within the classroom environment for teachers, parents and policymakers really incites
Great knowledge to have.
Here.
I think most parents would. Dr. Steele, also too, I think often we are, unless we're directly affected by this, people might think we're talking about, and we are, I suppose, we're not excluding anyone, but just the general population, and to try and limit them being off school for being sick. But there's also an awful lot of children who are immune compromised or are going through cancer treatment or whatever, that I'm sure parents listening who are parents of those children and are probably anxious with them going to school but want them to participate, right, and have as normal lives as possible. Presumably that would help to protect those students as well if the air is cleaner.
Absolutely. And I think anybody with asthma or anybody with a disability sometimes can feel very excluded from the education environment because of poor air quality or perceived risk within the classroom, which is actually a real risk. But even contracting infectious disease, one parameter in the classroom, can induce disability. I mean, the long COVID rates in children are 7.6%. That's UK data, but there's a presumption that it's similar here in Ireland as well. But somebody who's immunocompromised needs to have a safe environment in order to attain an education. But there's also other things, like there's data showing that performance is increased, cognitive tasks in maths and English are increased with reductions of PM 2.5 within the classroom. So it's not all about infection, it's about education, learning, resilience,
brain function,
inclusiveness within the classroom and education environment. So there's a lot of parameters to be addressed. But what we want, just in response to the minister's focus on unexplained absence in schools, which, it's good to have data on that as well, because potentially some of that is also illness related. But we have an increase of 465,000 in post-primary schools in 2017 illness absence to 938,000 in 2022. So that's a massive increase. Why not focus on that? I mean, there are maybe controversial spendings in the last few months, but we know that there's a ninefold return on benefit on spending on indoor air quality within the education system. Why not do that?
Sinead, someone might be listening and say, I ate my dinner out of the sink when I was young and it never did me any harm. What about that sort of notion that you need to sort of be exposed to the sniffles and the coughs and what have you? Or maybe Dr. Steele, you want to take that one, and that, I don't mind, it's up to either of the two of you, and that this is, and this helps build up your immune system and protects you into your teenage and adult years.
No,
well, sorry, I'll let Ciara answer that one on the health point.
I think people have confused a hygiene hypothesis of, which is also debunked, on the reduction of allergy or autoimmune disease by in exposure to, infectious pathogens. That's a controversial theory. It's been largely dismissed with knowledge in the last few years. And contracting a serious illness like RSV, for example, which can not only trigger asthma but actually induce asthma in children. The idea of catching a pathogen to be healthy isn't really holding sway anymore in the scientific communities.
Okay. So Sinead,
just to add to that
yeah,
point,
go ahead.
sorry, just a lot of harmful pathogens actually begin with cold-like symptoms, like measles. So catching a cold, it could actually lead to something much worse. And we're unfortunately living in a time of vaccine resistance and hesitancy, where many people aren't getting their childhood vaccines that would actually, reduce the spread of a lot of these pathogens. So yeah, just to add to what Ciara said.
And Sinead, just a question for you. Obviously Dr. Steele's outlined there the financial argument. There is a return on this, so it's cost neutral. We found 9 million for the pouches, which I'm suspicious that Dr. Steele was alluding to. And also to, we've seen a spike in absenteeism, so there is an issue there that needs to be resolved. Where's the resistance coming from here? Because we're told we're awash with money. I wonder, does the Department of Health come back to you and say, well, this is our reaction to what you're proposing?
Well, I think that it's the Department of Education that is holding back. And I know for a lot of our members, when they approach their schools and their principals, and they point to the HSA guidance that shows that there is a legal obligation to improve indoor air quality. And the schools say, well, we haven't received a circular from the Department of Education. And so I think they're having gone the route of putting this little code of practice out there, but not then issuing a circular. It provides a bit of a legal buffer for the department to say, well, look, we've provided the guidance, we've provided the information, excuse me, it's up to the schools to implement it. But without having actually said anything directly to the schools, they can, the schools are sort of in the dark on this. And so there's definitely a communication issue, whether it's deliberate or not. I can't obviously say, but that seems to be where the problem is. And maybe there's just a fear that it's going to be too costly to roll out the HEPA filters, but also I suppose there's the liability aspect as well, that, well, we've allowed children to go back to schools, in a COVID world now. Like it's kind of just a standard infection that's out there, and people have been harmed. And so maybe there's a fear that there's legal liability there that they don't want to have to deal with. But like you can't ignore these numbers anymore. And like, as I say, that's 2022-23 data. We haven't even seen the 2023-24 data. And that's 9 months overdue now. So I can only imagine how bad those numbers are going to become.
All right.
Yeah.
Last word to you, Dr. Steele. Ciara?
So we want to focus on improving indoor air quality in schools for educational and health purposes for our children within the education system in Ireland. And we call on Minister McEntee to introduce that really as urgently as possible.
Thank you very much for your time, both of you. I really appreciate it. Very informative, and we'll see what the listeners have to say. Take care. Thank you very much indeed, Sinead O'Brien and Dr. Ciara Steele. Thank you very much indeed as well. Okay, you are tuned to the 9 till noon show here on Highland Radio.